More and more young athletes are developing serious injuries to the ligaments in their elbows, some requiring surgical repair before they're even out of high school. If you've ever watched a Major League Baseball game, you've no doubt heard about Tommy John surgery. Well, it just doesn't affect the professionals. They're young athletes who deal with elbow injuries. And for that, we turn to the professionals, Dr. Tyshawn Lynch, Dr. Christopher Ahmad, and one of Dr. Ahmad's patients, 16-year-old Mike Pizzi. Dr. Ahmad, let's talk about elbow injuries in general, the youth level, the professional level. Is it the epidemic we seem to think it is?
Well, Kim, you're exactly right. At the major league level, we've seen an alarming rate of number of Tommy John surgeries. Almost every team every year gets affected by it. But what concerns me and physicians who take care of baseball players are the young athletes. My office is getting filled every week by more and more high school athletes with elbow pain. And we go through diagnostic testing. Unfortunately, many of these young athletes are turning out to have the dreaded injury, the ulnar collateral ligament tear. So even in the past few years, we've seen alarming rates in the young athletes that are mirroring what we're seeing in professional baseball.
When it comes to taking steps to avoid the injury, what advice would you give young athletes?
It's the athletes who throw with the highest velocities that put the most stress on their ligament. High velocity, too much throwing year-round are the big three.
Dr. Lynch, is this simply an overuse issue?
Overuse is certainly one component of this. This is not just an elbow issue, but this is really a whole body issue. The energy to throw a baseball fast not only comes from the elbow, but really comes from the bottom up, comes from your feet all the way up to your shoulder, to your elbow, and out through your hand. And what we know is that any muscle weakness that might be present in the lower extremity can manifest itself as a potential injury in the upper extremity.
Dr. Mai, when we talk about upper extremity warning signs, where would you start?
Well, the first is having pain. And when Mike first came to see me, it was clear that he was having pain. And show us, Mike, where you were having the pain.
It was right above the elbow, right above the bone.
Any throwing athlete, especially a pitcher who has pain on the inside of their elbow, must be evaluated and they must stop throwing, because this is the telltale sign that there's a potential problem with the ligament. So tenderness, pain in the inside of the elbow mandates stopping throwing and having an evaluation.
Mike, you were diagnosed with needing Tommy John surgery at age 15, right? You're now 16. Did you try to play through the pain?
Yes, I did. And playing through the pain is never a good thing. But I did take multiple breaks. I did ice, I did everything the doctor said, but it got to a point where I did need Dr. Ahmad to step in and ultimately do surgery.
What was that feeling like to know that in your heart you thought you had an injury, but obviously you needed answers?
Knowing that I was going to miss some parts of school and knowing that I was going to miss playing baseball with my friends every day, it was tough for my mind to wrap around.
Mike, when you look back now, well over a year out from your Tommy John surgery, what were your telltale signs? When did you start to think, I have a real injury here?
When I lost the feeling in my fingers after throwing, just a lot of vibrations, my fingers coming down my arm, I knew that I had to turn to a doctor.
But really, Dr. Lynch, this is about treating the whole athlete, isn't it?
Oh, absolutely. When we evaluate these patients in the office, we're not just looking at their shoulder, we're not just looking at their elbow, but we're looking at their whole body and assessing for any muscle weakness, any loss of motion that might be coming from the lower extremity, because usually these are the telltale signs that an athlete is overcompensating so that they can keep their velocity up.
Is there a certainty that if you have the surgery and adhere to all of the guidelines, all of the medical information and advice, you're going to be okay?
We like to believe that, Kim. And the reasons why it's challenging is because the surgery itself takes about 60 minutes, but the recovery takes up to 14 or 16 months in some situations. During that entire process, there's intense physical therapy, there's working on proper mechanics. Your ability to get back to competition has to be monitored. And throughout that process, there can be some bumps in the road, but with proper supervision, commitment from everybody involved, we hope for the best, and that is a result where the patient gets back to playing.
Mike, what would you tell any athlete, any young athlete who learns that he or she might need elbow surgery?
It does take a lot of time and for a long period of time, but it's just relax, it's going to be fine.
There is light at the end of the tunnel, right? Doctors, thank you so very much for your expertise. Mike, good luck to you, your academics, and your baseball career.
Appreciate that.
And thank you so much for joining us. We'll see you next time.